everyone. Good morning to all you lovely people. Um, I just want to just check that this live has started because I do have some internet issue today, but I just want to make sure that everything's fine and you guys can hear me and I'm audible and visible to you guys. I'm sorry if there's some network issue. Please, some feedback would be great from you guys. So if you guys can just tell me that you can hear me properly, I will continue to talk. My name is Sukhmani Sadana. I'm your host and your moderator for these live web sessions which happen by Drools on every Sunday. As you guys know, the reason why we've been having these sessions. Hi, everyone is saying very nice. Hello, ma'am. I'm assuming you guys can hear me and see me if I'm getting thumbs up and smileys from you guys. So, guys, just to give you a heads up, you all know that the reason why we do this live web session at Drools on every Sunday is basically because at Drools, we believe in feeding the right kind of ingredients and the right kind of nutritions to your pets, and that's the reason why we like to bring in this live vet session to basically help pet parents such as you guys to give you information from experts from all across the world. We have qualified professionals, we have vets who have studied and understood pets really well, a lot more than I do. And basically we want to give you qualified professional information to pet parents. You guys can kind of have an easier journey with your pets, right? So as you all know that very often we bring back a pet back home, but we don't really know what we're supposed to do with the pet. And we're really clueless in terms of what the issue might be with our pet. And one of those issues is tick fever. And that's the topic that we are discussing today. We will be discussing tick fever. As you all know, it's a potentially fatal disease for pets, and they can catch this disease from numerous ways. And although it may take up about 14 days after your pet really contracts the germ for any sort of symptoms to appear, still there can be few precautions which can be taken, and tick fever can be avoided and diagnosed and treated. So why not? If we could avoid it, why not, right? So I hope everyone is here with me, and we have a very special person today who's joining us to discuss tick fever. And our guest today is Dr. Shivali Sharma. She's MBSc Surgery and Radiology. I hope she sent me a request because I'd like to just add her here. So I just hope that the internet is fine. Looking forward to having a chat with Dr. Shivali, and then I will tell you a little bit more about why we have this live on every Sunday. Ma'am, I've sent you a request. If you can please accept that, that'll be great. There she is. Hi, can you hear me?
Hello?
Dr. Shivali, I need you to turn your camera so I can see you. We can't see you right now.
Okay, just a minute.
Yeah. Yeah, you have to just
Hello?
the camera, yeah. Hi, how are you?
Hello, Sukhmani. How are you?
Very well. First of all, thank you for joining us, and I want to just thank you on behalf of Drools for taking our time for our session today.
Thank you so much. Thank you so much, Drools.
So, Doctor, we are discussing tick fever today, and I'm going to be asking you a few questions. And at the end of the session, we're going to get questions from our audience, and one lucky person will come from you, and they will be asking us tons of questions, I'm sure. But just to begin this conversation, how is tick fever transmitted, and what exactly is it?
Okay. So, Sukhmani, do you have pets?
Sorry?
Do you have pets?
I have it.
Okay. So you must have seen ticks around them.
Yes.
Whatever you do, whatever you do in this monsoon season and pre-summer season from April to September, you come to see brown ticks on your dogs. Very rarely on cats, but on dogs, mostly on dogs. So the ticks which bite, that causes a protozoan disease which is called as tick fever. And in India, generally we see three types of protozoan diseases, such as Ehrlichiosis, and Babesiosis, and E. canis. And three of them together, or one, it is called as tick fever.
Okay, lovely. And what are the most commonly associated, what is commonly associated with the transmitting tick fever to any sort of pet, like a dog or a cat?
It is actually transmit. It can come on your dogs while they are going for a walk, through stray dogs, or it is in grasses. The breeding grounds are like grasses, and once it bites your dog, it causes tick fever. It may or it may not, but it causes tick
Right.
fever.
Right. So, are there any symptoms? Because I'm sure the audience wants to know that. Which are common symptoms that we can watch out for in case our pets have tick fever?
Absolutely. Generally, tick fever, the most important thing we see is temperature. Fever means temperature. So you will see temperature which is coming and going and which is always above 104, 105. The pet becomes lethargic, doesn't want to eat much. Okay, appetite loss, which cause anemia is there, which you can see if you take a look at the conjunctiva under the eye. If you see it, you'll see it is pale. It is not pinkish. So that is actually anemia. And then there will be stomach pain. If you'll touch the stomach, the pain, maybe the dog will tighten it or maybe cry. Little bit of cries there. That is because liver is enlarged in tick fever. And we can see nasal bleeding in tick fever. You can see when platelet count goes very low, you can see bleeding in nose, in urine, or in stool, or even in eye. If platelet count goes very low, even in eye, you can see the eye is turning red. These are the major symptoms.
But that's quite a lot. I think those are a lot of symptoms to watch out for.
Yes, but most probably you will see is temperature, fever. First sign is fever.
Okay, first sign is fever. And can tick fever be transmitted from pets to humans?
No,
I've been very
no, it is not. No, it is not possible. That is not there. But of course, you see ticks running on your sheets. If your dog or pet has more ticks, you can see them running on your sheets, on your grounds, on your walls. But it's nothing is transmitted to humans.
well. And what diagnostic tests are available basically for detecting tick fever in pets?
Uh, Foremost, we should go for a blood test. First thing is we have to go for a CBC blood test, in which we will determine the hemoglobin and platelet counts of the dog, which is the major cause, which will drop instantly when dog is infected with tick fever. And then there are snap test or rapid card test, like a pregnancy kit you must have seen. So nowadays you get rapid card test, snap test it is called in markets, and the blood is drawn from the dog, the serum is collected, and it is put in the snap test, and you get the result instantly which kind of protozoal disease the dog is having. Or thirdly, you can go for a PCR test.
Okay. Pretty simple. So three ways to diagnose is what you would suggest.
Yes, there are a lot of ways to diagnose tick fever.
And how is tick fever treated in dogs and cats? I mean, not that we can really do much about it at home, but how are they treated?
Actually, you should not do any home therapies at home. Like people are putting videos कि आप घर पे ये कीजिए और lemon grass को spray करिए and all those stuff. It's not very much because it is fatal. The first point is it is very fatal in dogs. So you should rush to a veterinarian if your dog is coming up with fever, which is more than 104. You should go to a doctor. The doctor will take out the test and it will be diagnosed properly that what is the problem with your dog. And then the treatment includes antibiotics. It may take fluid therapy, some anti-protozoan drugs. So everything will be determined on the condition of the dog. See, it is not important that the dog has tick fever. What we will take care of is, as a veterinarian, what we will do is we will take care of the symptoms which are appearing in your dog. So maybe your dog is having less symptoms, the other dog is having more symptoms. So you can't tell the other person that, bhai, maine to ye kiya tha, you do it. So that is not possible. It is not a hit and trial method nahi hai ki aapne ye kiya and it is done. So you have to take care of all the parameters and then the treatment will be discussed with the parent, pet parent, and it will be done to the dog.
Right. So, doctor, tell me that it's interesting to know that every time it's not the same as what you're saying, the treatments. Are there any preventive measures? Because this is something that's very important for the audience to know. Any preventive measures which pet owners can take to reduce the risk of tick fever?
Absolutely. As I told you that the season starts from pre-monsoon, pre-summer, from April to September, we kind of see a lot of ticks on dogs. It is the breeding season for ticks. So for that, for prevention, we have tick collars, we have tick spot-ons. Such spot-ons are available in markets, which you can take from the market and you can apply your dog. There are tablets like Bravecto, Stemparica is there. You can use such tablets, which is on monthly basis. Once in a month, you give it to the dog, and it will take care. Uh, and shampoos are there, sprays are there, tick sprays are there, powders are there. There are a lot of things you can do.
Great, great. And can pets develop immunity to tick fever after an infection?
No, it is not there that once your dog is infected with tick fever, next time he won't get a tick fever. It's not, every time he gets a bite from a tick fever can relapse. Absolutely, it can relapse.
So that's scary, right? Because we might feel
Yes,
that
it is.
in case
It
we
is scary.
uh,
If you think your dog is having tick fever or he's having fever, you should get it actually get it diagnosed properly and treated as early as possible.
possible. And are there any natural remedies or supplements that can support pets with tick fever?
Not any kind of a natural remedy, but just like dengue, we try to increase platelet counts in our body. The same thing can be done once your dog has tick fever. You can do that, like you can give beetroot, kiwi, some goat milk. You can give buffalo liver to increase the platelet counts. Or nothing else you can, nothing such thing that you can prevent it. But once you have it, you can use some home remedies to help the dog to recover fast.
That's pretty cool. So, what is the role of the veterinarian, in educating pet owners about tick fever prevention?
We always do that once we see even a single tick on dog. We always tell them to use any kind of a preventive measure so that the dog doesn't suffer from tick fever. As I told you, tick collars and tick spots. And people are very much nowadays, they are they know everything. They know it everything from Google also. But we always help them to, and we guide them that how it can be prevented. If something is not working, what else you can do? You can go for injectables also so that ticks are not there. So this is the role of a veterinarian. Afterwards, of course, the treatment course that should be done by a veterinarian only.
Right. Even we keep saying that we keep reiterating in every live of ours that sometimes we feel like we know everything and then we research everything on Google. But guys, if you're watching this show, this is what we always say: please ask your vets because they know the best, and don't assume that you know it. And the qualified people we have here, so that's the whole point. So, ma'am, these were the only questions I had for you.
No
So we're gonna
problem.
take from the audience now and see because I think your answering was so appropriate and crisp and nice. It was just to the point, and we got a very nice detailed analysis in terms of how we can take care of sick people, which is lovely. So I'm going to take some questions from the audience now. Guys, if you have any questions regarding tick fever, please go ahead. Um, Asif 2789 is saying that the cat ages of 2 months and not eating, and 2 months weak, 2 weeks. Cat.
Okay, it is not actually associated with tick fever, but of course, if cat is 2 months old, first you have to see that the cat is dewormed or not. It is not eating. There are many causes of not eating in a kitten. So you have to take care of that first, like if the cat is dewormed or not. So take him to a vet. If the cat is having temperature, even then the cat will stop eating food. Or if she's suffering from some other viral disease. For that, you have to go undergo some test, and then only we can tell what has happened to the cat.
Alright guys, any more questions for Doctor here? We have Dr. Shivali Sharma who's waiting to give us some nice questions from you guys regarding tick fever. So bring on your questions and you guys know one lucky person is going to happen from Drools. So come on. Because I did ask you some really little questions which were the first hot questions which come to our audience. But we might have missed out on something. Just going to wait here for the audience to give some questions. Meanwhile, Doctor, is there anything else you would want to tell us about tick
Uh,
fever?
just for the maybe for the like shampoos you can use for prevention. That is the
Correct.
thing. And when the pet is not eating much, you have to take care of the nutrition also, because in body anemia is there, platelet counts are going down, lymphocytes are going up. So actually, the dog is fighting with kind of a infection. For that, you have to give him a balanced diet. So generally, when our dogs don't eat, we have a Vet Pro recovery. Vet Pro recovery food is there. So it's kind of a gravy. It is very easy to administer to the dog. You can eat, or you can put it in an injection and feed the dog so that he gets a balanced diet to recover from the protozoan disease.
Right, right. Okay. Guys, any more questions here? This is the time for you guys to bring in your questions. We're waiting to know if you have any queries at all, and we're very happy to address them all. We are low on questions today, which means it's a good sign. That means that you have explained things really well, is what I would say. Um, just guys, if you have any questions, this is the time for you to ask. As you all know, we're discussing tick fever, and we have discussed all sorts of prevention, symptoms, treatments, hopefully, how to build their immunity maybe and stuff like that. But in case if we've gotten something to ask a question now.
Or you,
Okay.
or else you can talk, you can chat with me anytime if you want.
Yes,
Even if you have questions afterwards, you can always send me or DM me your questions, and I would love to answer your queries.
yes. So you guys heard her. If you have any questions regarding tick fever, you can always reach out to her or reach out to us on social media, addressing your answers on your DM. Um, so I'm getting a lot of compliments. People are thanking you. So thank you so much. Audience is saying thank you and stuff like that. I don't see any more questions, doctor. So I guess this is it. Thank you so much. It was lovely chatting with
Thank
you.
you.
And
Same
thank
here, same here. Bye bye. Have a nice day. Bye bye, Sukhmani.
thank you. Alright guys, that brings us to the end of our session today. We didn't see questions coming from you guys, which means our doctor was amazing. And that brings us to the end of our session today, but I will see you next Sunday at the same time with another vet and another subject. And Asif is not the winner for today because you're the only one who asked us a question. So I just now give you a minute. Asif 2789, congratulations, you're the winner for today, and you're going to win a hamper from Drools. So somebody's going to get in touch with you. Meanwhile, everyone else, I will see you next Sunday. And like I always say, don't forget